Hi, I have been talking about gastroesophageal reflux in babies and how difficult life for a baby who has reflux can be for various reasons. Many of my patients that talk to me about their baby with reflux, they always ask me how long it's going to last, when it's going to go away. People think that reflux should stop by 1, maybe by 2 years or so. They're wrong. They are absolutely wrong, because reflux continues. In most babies who have reflux, the problem continues and goes on and on for at least a few years, and in quite a number of babies that have reflux, the problem continues until adulthood. Many adults suffer from reflux, as probably all of you know. But how does reflux manifest itself in children that are beyond the neonatal or the first year or two? Well, it is different. It does manifest itself in a different way, and I would like to tell you and explain to you how it shows itself, so that you can guess it, guess the presence of this problem and maybe do something about it. Well, one of the things that children beyond the first year or two keep complaining about, besides complaining of a stomach ache frequently, is the fact that they do not want to have breakfast. They're not hungry when they just wake up. Their stomach is not ready. Yes, the not having breakfast is one of the things that is characteristic of these children. They also wake up with a mouth that doesn't really taste nicely, and actually their breath is not so nice. They have a foul breath frequently. A foul breath in a child is a symptom which is absolutely clear of reflux, of esophagitis and reflux. Other things that happen may be much more problematic, like a child who has reflux can have episodes of repeated vomiting, vomiting that can go on for a day or 2 or 3, and they can lose weight because of that, and they can keep on vomiting if they don't get treated. The other thing is that they don't sleep well. They are frequently moving around, getting very agitated during sleep. They talk, they moan. They have very bad dreams. They frequently have nightmares. They sit up with their eyes fully open, but they're not awake. They're still sleeping. They have parasomnias. Some of them get up from the bed and start walking while they're still sleeping. They have basically sleepwalking with reflux. Yes, reflux causes that. And not all the time, obviously, but it's one of the causes of sleepwalking in my experience. One thing that children with reflux have is the motion sickness. They sit in the car a few minutes and they start getting the nausea and the tendency to vomit. This is, I think, caused by the esophagitis. The esophagitis can do something else. Can cause episodes in which the child becomes very, very pale, very weak, and collapses, basically has a fainting episode. This is very, very frightening for parents, seeing a 2-3-year-old that has this sort of episode. One can be frightened that is on the verge of dying. No, it's common. And why does this happen? Well, this happens because the fibers of the vagus nerve around the esophagus get hyperstimulated by the esophagitis, and this hyperstimulation causes the extreme activity of the vagus nerve around there, and that causes the low blood pressure and vasoconstriction. All the vessels get very tight and one gets very pale. Frightening. Everything that I'm saying, though, can be treated, and I'll tell you how after telling you another thing that can happen with reflux and esophagitis. Older children, they have a tendency not to want to eat solid pieces of food. They start refusing eating little pieces of food because it gets stuck in their throat. They suffer from what is called dysphagia, which is difficulty swallowing, because the esophagus is inflamed. And that's the reason why they have difficulty swallowing, and they don't want to eat little pieces, and they get frightened that they can suffocate on the pieces of food. They get stuck on their throat. Not nice. All of the symptoms of reflux in older children are due to esophagitis and to the acid that comes up, and like in smaller children and babies, all of these symptoms can be treated, can be eliminated, and the child with reflux can feel better almost immediately if he's treated properly, and can feel, after a treatment of a few weeks, can feel well for a long period of time, and once in a while have the symptoms come back and be treated again.